Hi everyone, welcome to ResearchMD.com. We got another great presentation today. Today we're going to teach you all about autoimmune hepatitis, okay? So when you talk about autoimmune hepatitis, again, remember it's an autoimmune disease causing inflammation, fibrosis to the liver, and then subsequent damage. Just remember that, okay? So that is what the definition is. When you talk about autoimmune hepatitis, there's like two types, type 1 and type 2. It's good to know like the difference between them. Type 1, you will see anti-smooth muscle antibodies. It's more common in males, okay? And we talk about type 2, you got anti-liver, kidney microsomal antibody, LM1, LKM3, and then you got anti-liver cytosol antibody also, and more, 38% could be in the children. So remember type 1 and type 2. Okay, now if you look at the etiology and epidemiology, more common in females, right? This is like autoimmune. So what happens, in primary bilirubin, which one, men or women? What is common more?
It's in women.
In women, primary biliary cirrhosis. Okay, what is the ratio? Like a 10 to 1 favors women.
Yes.
Okay, what about primary sclerosis? Primary sclerosing cholangitis, what's
More common in males.
In men. Okay, here, autoimmune hepatitis, somebody tell me?
More common in females.
More common in female. Remember that. Very, very important. Okay, because when somebody, most of the time, if I'm writing a question, I would say like a 56-year-old female comes in, you should know what is the examiner is going to go. So it's very important to know those kind of things. That's why I mentioned it. Okay. So what are the clinical features? Usually the present. Mainly, like a lot of times could be asymptomatic. You just only thing you might see like elevated LFTs, then you're trying to do all this investigation to find out what's going on. You have to rule out all the other causes. But other cases could be fatigue, upper abdominal discomfort, mild prurite, anorexia, myalgia, and loss of appetite. Like non-specific, some of the symptoms can be there. And later on, in the late stages, could be like a jaundice also. Remember that, okay? So now, the next thing what we know we need to do is like look at the pathophysiology. What actually happens in autoimmune hepatitis? Okay, what happens? We talk about autoimmune disease, you got like environmental genetic triggers involved in it. It's better to know like what else there. You got infection, hepatitis A, C, E, EBV, varicella, and the cytomegalovirus. That could be like contributing to this. And then you have molecular mimicry happening over here because the body is trying to, recognize this antigen-presenting cell kind of interaction, and the cascades just kind of go all over the place. Okay, so you got B cells activation, plasma cells. That's why you got what? Anti-smooth muscle antibody comes in. That's why we check it, right? That's one of the important tests we have to do. And then CD4 cells activated. Then more damage and that comes into play. You got natural killer cell 2H17. Inflammation, injury, apoptosis, fibrosis, boom. What happens later on? Liver cirrhosis, okay? End stage, and that's what it is. So everybody can understand the role of molecular mimicry, hepatitis A, all these infection agents, good to know and all that. Hepatitis A, C, EBV, varicella, and cytomegalovirus. And the genetic got HLA, DR3, and DR4 components into it, okay? Got it? So like what kind of lab tests you need to do? You do your LFTs pretty much, okay? And so you got ALTs elevated, AST also elevated. Look for the ratio. It's very important. Look at the AST-LT ratio, usually less than 1:5. Okay? Remember that. That's like very important. So, and then there's a lot of markers you should be doing when you're suspecting autoimmune hepatitis, okay? And those are, what are the markers? You check for ANA, because again, it's autoimmune disease, that's kind of standard, everybody know that. Anti-smooth muscle antibody, okay, anti-mitochondrial antibody, okay, and then you have to check anti-liver kidney microsomal antibody, and then you have to check also IgG level, okay? So all these tests you have to order when you're suspecting autoimmune hepatitis, remember that. So it's a battery of tests you have to do. So what else? Well, diagnostic criteria. If you look at the diagnostic criteria, let's look at it. What's the most important diagnostic? You have minimum 1 elevated aminotransferase, right? Usually most of the time you have to be LT and ST, so yeah, minimum 1 elevated ST or LT, remember, okay? And then you have minimum 1 positive lab test. Any of this we talk about the ANA, SMA, AMA, and anti-LKM, okay? And then we just talk about this IgG also. Now, That is the criteria. And then liver biopsy. Let's talk about liver biopsy. What are the findings you can have? Like, it's very important. It's required when you have like autoimmune hepatitis, right? The other one, you don't need like liver biopsy, but autoimmune hepatitis, lymphocytic infiltration, necrosis, and fibrosis. Those are the characteristics you will find in the liver biopsy. Remember that, okay? It's very, very important to diagnose in liver biopsy. Very, very important to get this battery of tests, right? Should I go over again? Just say like, we talk about, everybody knows the liver function test. ST-LT ratio is like ST to LT ratio is less than 1.5. Then you got anti-NA, you have to check for any autoimmune disease. You got SMA, you have to check. Anti-mitochondrial antibody, you have to check. Anti-LKM1 and IgG also you have to check. Okay?
Okay.
So like liver biopsy, we talk about liver biopsy findings. We talk about the diagnostic criteria, minimum 1 elevated aminotransferase, and then minimum 1 positive lab test, whatever like IgG and all those kind of thing, okay? And then treatment, first line treatment, steroid. Autoimmune disease, steroid is the mainstay of steroid, corticosteroid. And you can also use isotherapy. In second line is mycophenolate. And what are the complications? This is the complications you have to worry is, of course, liver cirrhosis, liver failure, sclerosing cholangitis also could be like one of the complications, okay? Sclerosing cholangitis could be cirrhosis. So imaging, the question always comes, would you do imaging studies in this? Only time you have to do is like you're trying to rule out the other causes. Other than that, it's not a much role in it, right? You have the lab test, you have the biopsy, and all of those kind of things. Okay, so did everybody got it? Right?
Yes.
So it's more. Remember, the most important is an autoimmune disease, right? And then what? More common in females, right? The symptom, I wouldn't say like kind of asymptomatic. Then I see this molecular mimicry, role of hepatitis C, B, and all those kind of things come into activation cascade, and you got B cells, plasma cells. That is the most important, and a smooth muscle antibody comes in. Very important, okay? And then you got a CD4 NK8 cells, and the lab test we already talked about, remember, ST-LT and ANA, SMA, MA, anti-LKM1 and IgG, the biopsy results, and think about the treatment, corticosteroid. Those very important to know, okay? Thank you so much for watching. If you have any comments about our presentation, please put it under the comment section, and please subscribe to our channel. Thank you so much.